Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Dhyavanapelli, working as assistant professor at Department of Pharmaceutical Science and Technology, Institute of Chemical Technology, Mumbai. So, in our novel drug delivery systems, we started with the targeted drug delivery systems. In our previous session, we have discussed what are the targeted drug delivery systems, and there we have seen the basics and the fundamentals of the targeted drug delivery systems. Here we have discussed what is the need for the targeted drug delivery systems. After that, we have discussed what are the advantages of the targeted drug delivery systems, and in the last we have seen the strategies of the targeting approaches. So, in that we have discussed with the what is the passive targeting, active targeting, and further we have discussed levels of targeting. So, in my today's session I am going to discuss on some of the targeted strategies. So, in that these are the flow of today's my presentation. So, here I am going to discuss on the disease based targeting strategies. So, this will works on the various types of the diseases, and then I will look on the organ based targeting strategies. So, based on the different organs like brain, liver, we can also target the formulations, and later we will see in the deeper things which are cell and organelle based targeting strategies, and at the end we are going to see what are the carrier based strategies for the targeting. So, as we know the definition of targeted drug delivery strategies, which involves the administration of the drug delivery systems to the patient, the delivery of the drug delivery system at the target site, and the release of the active ingredients in and around the target, which will help us to avoid the non-specific toxicity, nothing but side effects, adverse effects in the normal cells. So, yes, as we know the definition, so target drug delivery, the main purpose to reach the target site, nothing but diseased condition, the pathological condition, that is a one main point, and another point, and at right time and that right place your drug should be released out from that carrier systems. So, with this image we can understand, consider this is a viral particle. So, if you want to kill that virus, we must be targeted on the host cell where virus is infected on the cells. So, then with that system we can deliver the drugs into the specific location. With that we can reduce the side effects, and definitely we can enhance the safety of the patients. We can also improve the patient compliance. So, that is the advantage of the targeted drug delivery system. So, as we discussed, so these targeting strategies can be classified into 4 sections. So, first one is the disease based targeting. So, here yes we can also target by disease. So, now here you can see these are the various types of the diseases. So, here you can see first one, that is a neurodegenerative disorders, nothing but all type of central nervous related diseases which we can target by using the disease target approach. Cancer, and then gastrointestinal diseases, respiratory diseases, and infectious diseases. So, how we will do? Based on their the microenvironment, changes in their pathophysiological conditions. So, we can target the various types of the diseases. So, disease targeting refers to designing of therapeutic systems, nothing but here drug delivery, gene therapy and the diagnostic agents that specifically reaches to the disease site. For example, the tumors and the inflammatory tissues and the infected organs by exploiting the biological differences between healthy and diseased tissues. As we know that in tumor, so we will see lot of the pathophysiological changes in the tumor cells compared to the normal cells. So, based on that we will target the disease. So, now instead of distributing the drug uniformly through the body, the target system concentrate the drug where it is needed most and increasing the efficacy and the minimizing the side effects. So, this is the one of the approach. By this we can also target the medicines. So, few example we are going to see in this presentation, that is first one is the cancer based targeting strategies. In the disease based we are discussing first cancer based and after that we are going to see infection based targeting strategies. As I mentioned, so in cancer you will see there is a change in their physiology. So, whenever you see the cancer strategies, so we need to consider tumor microenvironment. So, in the tumor you will see there is a formation of the new blood vessels which is nothing but angiogenesis, and there is a change in the lymphatical system. So, you will see lot of changes in the cancer cells compared with the normal cells. So, these are the various changes we will see in the cells. So, the first one is the hypoxia, lack of oxygen because of abnormal growth of the cells in the cancer cells, and also the low pH is the one more factor because of the high metabolism happens in the cancer cells, and the specific enzymes and high glutathione expression and also increased ROS systems. So, with considering all this we can target the cancer cells. So, yes, whatever all the changes happen because of the mutations in the cells, so that will help for the cells to grow and also to survive and also help for the invasion in the body. So, people have, the scientists what they did, they have targeted the cancer by using various approaches. So, here cancer targeting drug delivery means designing of drug systems that specifically reach and kill the cancer cells without affecting healthy cells. So, now here we can see here these are the two different type of strategies, passive targeting and the active targeting. With that we can reach into the specifically to the cancer cell instead of normal cells. So, this is one example here we can see these are the targeted by using the stimuli response. So, here the stimuli is near infrared response. So, these are the gold nanoparticles which will respond with the near infrared. With that, when it reaches to the cancer cell, when you give the stimuli from the external source, so the carrier will stimuli and then it will release the required molecule at the target site, where in normal cells it may reach some concentration of the carriers, but the drug and the carrier will not show the effect. So, with that we can reduce the side effects. So, here these are the tumor cells, these are the tumor capillary. Now, you can see after administration, so from the blood it will reach to the capillaries, from the capillary to tumor cells. Once it is reached, then we need to apply NIR laser. So, with the stimuli response your carrier will undergo sensitization, then it will release the required molecules, and that leads to the apoptosis and necrosis. So, this is one approach based on the tumor microenvironment. Yes, the pH also possible, you can go with a low pH we can use that low pH targeting system. Even angiogen is also one of the factor. So, in another example, that is the infection based targeting strategy. So, here yes, we know there are the so many infections like tuberculosis and HIV and various types of the infections. Yes, this all happens because of the bacterial attack and the viral attack and the fungal attack. All these are considered as a infection diseases. So, this can also targeted by one mechanism is that host cell targeted system. So, here pathogens will attack on the cells which are called as host cells, like in case of HIV the T cells, in case of TB it is in the macrophages. So, this infection also can be targeted based on the host cells. And there are a lot of changes happen in the tumor microenvironment. Changes happens in the infectious disease, that is a microenvironment targeting. So, the change in the pH and the high level of ROS systems and also the enzymes, with that also we can target the host cell. So, this is a one best example here I have explained with the virus and host cell interaction and the replication. Now, here we can see this is the virus. So, it will bind to the cell on the various mechanisms. By one example is that receptor binding. So, with that, so the virus will interact with the receptors on the cells. Now, further it will undergo uptaken by the mechanism, and then it will undergo the processing and the polymerase reaction. Further it will undergo the replication, and then after the maturation, so it will release out from the host cell. So, as in a targeting of this virus or any type of infectious diseases. So, here what we can do, we can target the infectious diseases by inhibiting the entry. Otherwise, so blocking of these receptors and also blocking various protein synthesis, and then we can also avoid the release, so that there is no new virus will not release out from the host cell. So, with this we can inhibit or we can reduce the production or replication of the viruses. So, this is a second strategy we can use it for the infection based targeting. So, these are other location you can see, we can stop the translation, right. We can also stop the various replication and also maturation. So, these are all possible with the various drugs also. So, with this strategy we can help to avoid the infectious based targeting strategies. So, coming to the another topic, that is the organ based targeting strategies. So, now as we know that so disease category is a one section, and the organ based strategy, here what we will do, we will focus on particular organ. So, that organ, it may be infected or it may be with the other diseases. So, we will focus on that particular organ. For example, here you can see this is the colon, right. If you want to target this system, okay, so you have to select a right material, so that material will reach into the particular cells. So, here you can see the pH sensitive polymers we can use it, for example, which are cellulose acetate phthalate, hydroxypropyl methyl cellulose phthalate, and then copolymers of the methyl acrylic acid and methyl methacrylate. So, these are the some other type of the polymers we can use that, which works as a pH sensitive polymers, which will not dissolve, it will not dissolute from the lower pH. So, these are the polymers which will specifically release, and the drug will come out at the intestinal pH. So, with that we can also target the various molecules by using various types of the pH sensitive or colon specific targeting polymers. So, with this we can also target the various organs. So, in third topic we are going to see cell and organelle based targeting strategies. So, we are moving into the deeper layers of the cells. So, we started with the as in a disease, and then we have seen on the organ based. Now, we are going to see in the cells and the organelles. So, how it is possible? Cell and organelle based strategies focus on the delivering therapeutic agents or imaging probes to specific cellular compartments or organelles, enhancing treatment efficacy and the reducing the side effects. So, here we need to design the delivery systems. So, based on the various strategies to target the organelles in the cells, which are we can also target nucleus, we can also target mitochondria and the lysosomes, endoplasmic reticulum and the Golgi apparatus. These all systems can be done with the carrier systems, or you can say drug delivery systems or nano carriers we can target into the various cell organelles. So, this will specifically reach to that particular cells instead of normal cells. So, it will allow localized delivery of therapeutic agents, which definitely minimize the off target effects, and that will definitely will give the improvement in the therapy. Now, here you can see these are the various organelles. So, based on the disease microenvironment or by using various active targeting, we can deliver the molecules into the particular cells. For example, by using small molecules also we can target the cell organelles. By using cell penetrating peptides which will cross the cell membrane, that will also we can reach to the cells. By using nanoparticle carrier systems and then antibodies, and by using functionalization with the ligands, we can also reach to the cells and organelles. So, this is the third strategy, and here we will see here one major mechanism in the tuberculosis. Now, tuberculosis is the one of the major issue in the multi-drug resistance. So, to overcome such multi-drug resistance and to improve the safety, efficacy of the patient, so we need to target into the macrophages. So, to reach that we need to convert our formulation into effective dosage forms. So, now here we can see these are the various approaches are there for the treatment of the tuberculosis. Now, here you can see the oral route, and we can also use intravenous and the subcutaneous and inhalation routes. So, in a conventional by taking of the tablets and injections and subcutaneous inhalation, so it will not reach to the target sites. So, but if you want to improve the efficiency of your formulation, you must target on the macrophages. So, to overcome the limitations of the conventional formulation, your drugs need to be converted into the carrier forms. So, then it will reach into the target sites. Now, here you can see the delivery to the infected site, which is nothing but macrophage. So, by translating of converting of the conventional formulations and active drugs into the various nanosystems, by using the inhalation therapy, we can reach to the targeted sites for the tuberculosis treatment. So, these carriers will specifically bind to the macrophages which are already infected. So, it now further it undergo the various cell process, and later it will control the replication of the bacteria. So, with this we can also target the cell and organelles based strategies. So, the fourth one is the carrier based targeting strategies. So, here what we do, as we discussed from previous lectures also, even in the drug delivery system also we have discussed. Yes, so we have a polymeric nanosystems, we have a lipid based nanosystems, and also we have inorganic nanoparticles. So the list you can see here, which are all are the nano carrier based systems. Yes, carriers, the definition itself suggests that these will carry the molecules, nothing but which are the cargoes, which will take the molecules, take the active molecules and deliver into the right place. So that is the purpose of using the carriers. So with this we can expect the targeted drug delivery. So here we can use various substances which need to encapsulate or to load into the carriers, and that will deliver the drugs into the specific sites of the body. So that will improve the efficacy and also which will reduce the side effects. So here you can see various nano carrier systems, and there are the, you can convert into smart polymers. We can also use various biological molecules, drugs, proteins, peptides, and that we can encapsulate by using various stimuli response, the external and internal stimuli response. We can also activate the formulations within the cells. So these have a specificity. These carriers undergo, as we know that we can also use passive targeting system by based on the EPR and pH sensitive and the temperature sensitive, we can also target. And not only that, by using active targeting also, labeling with the antibodies and ligands, we can target into the various types of the disease. So far we have discussed on the 4 different types of the targeting strategy. First we have discussed disease based, then organ based targeting strategy, third is cell and organelle based targeting strategies, and the fourth one is carrier based targeting strategies. Now this can be followed by the various mechanisms in the body. So here we can see the various systems will help to reach the molecules into the cells. So these are these various transport systems will help in the cellular uptake studies, because there are the efflux system which are available in the body, which will not allow the molecules enter into the cells. So the drug efflux, nothing but that will efflux the molecule from the cells. So that leads to the low bioavailability and low efficacy. But when you use as a carriers which will bypass the all type of the drug efflux systems. So with that, with the internalization by either non-specific or specific endocytosis, which will help in the higher intracellular accumulation of the drugs, whether any type of the disease is there, but we can target by using the higher intracellular accumulation by using the carrier based strategies. So these are the few examples, that is maybe clathrin mediated endocytosis, caveole mediated endocytosis, macropinocytosis, and the clathrin and caveole independent endocytosis. So these are the various systems. With that you can use the carriers and it will undergo the cell uptake studies. Further it undergo the endosomal lysis, and then lysosomal processing happens at acidic pH, and then your carrier will release out and it will show the response. So these are the various systems, various types of the ligands also you can use, which will follow the receptor associated endocytosis mechanism. For example, transferrin, LDL, epidermal growth factor receptors, human epidermal growth factor receptors, and lectins. With this we can also target the various types of the diseases. So with this we are going to conclude today's lecture. So before that, if you want to read further on the target drug delivery systems or strategies, so I request you to go through this book. So this book highlighted various types of the target drug delivery strategies, and they are classified most of the work into based on the carrier based and also organ and disease based and also on the cell specific targeting strategies. So, I request you to go and read further on this topic. So, with this we are going to stop today's lecture, and in our next classes we are going to discuss on the various types of targeting strategies, in that the stimuli responsive and the multifunctional strategies, and we are also going to discuss on the tumor and the brain targeting strategies. Thank you so much.